Hi, I'm Dr. DeHondt from DePorre Veterinary Hospital, and we're going to talk today about cat spaying and neutering just to help you better understand these topics and why they're important things to do. Our practice manager, Sue, is going to ask me a few questions and we'll answer them.
All right, Dr. DeHondt, what is cat neutering?
Cat neutering technically refers to either castration for male cats or spaying for female cats. In practice, we usually actually use the term neutering to refer to male cats mostly, though.
And what is spaying a cat?
Spaying a cat is a procedure for female cats that is done where we usually remove the ovaries and the uterus in order to prevent further reproduction.
And how does spaying or neutering impact the health and well-being of a cat?
There are actually a lot of benefits to spaying and neutering. Specifically for female cats, spaying helps reduce the risk of certain cancers significantly. With the ovaries and the uterus removed, the risk of cancer with those organs is eliminated. And then for cats that are spayed before their first heat, their risk of mammary cancer, which is the most common type of reproductive cancer that we see cats get, is significantly reduced to below 1% if we spay them before their first heat.
And what about cats in heat? Are they fun to have around?
No, that's the other part of the benefit of spaying and neutering cats is that cats that are in heat do have significant behavioral changes where they're very vocal and needy and often, have some other unwanted changes, urinating in inappropriate places and things like that. And cats will, once they're old enough, will go into heat roughly every 2 to 3 weeks. So it's a fairly continuous process, and if we spay them, then we can eliminate those unwanted behaviors.
And what about male cats that are unneutered and unwanted?
Unneutered male cats also will have similar behaviors where they tend to exhibit a lot of marking behavior, so they'll pee around the house, and it's particularly foul odor with that type of behavior. They also are more inclined to want to roam, so they'll want to be outside of the house, they'll be going around the neighborhood. They're a lot more likely to get in fights with other cats where they can pick up potentially infectious diseases like FELV or FIV. So for all of those behavioral reasons also, neutering is an important thing to do.
Okay, what is FELV and what is FIV?
FELV is feline leukemia virus, and it's an infectious virus that affects the immune system of the cats. And FIV is also a similar viral infection that is also infects the immune system and can lead to health problems down the road.
And how soon should you bring your cat to see a veterinarian to get them spayed or neutered?
We generally target around 6 months or so to do spays or neuters. The biggest thing is we just want to make sure that they've been through their vaccine series first, they're healthy for anesthesia, we'll check their pre-anesthetic blood work, and once all that stuff is taken care of and we feel like they're, well checked out to do their procedure, then we would do the surgery at that point.
And what are the medical benefits of spaying and neutering cats?
The medical benefits are similar to the things we talked to, which is the biggest one is the prevention of these certain types of cancers, especially mammary cancers in female cats. There's also the prevention of interaction with cats that are more likely to roam or go outside so they don't pick up infectious diseases. Another potentially common issue that happens with intact female cats is they can develop infections of the uterus called pyometras, and once they're spayed, then the risk for those infections is eliminated as well.
And then how will spaying or neutering affect my cat's behavior?
Generally, I would say it would only have positive effects. It'll eliminate the behaviors that are often noticed with cats when they go into heat. It'll eliminate or at least reduce the marking and roaming behaviors with male cats. We don't usually see negative behavioral changes. Spaying and neutering does slow down the cat's metabolism, and so in some situations that can lead to weight gain, but if we carefully monitor their diet and feed the proper amount of calories, then we should be able to manage that.
And how should I care for my cat before and after spaying or neutering surgery?
After the surgery, we would go over everything as far as discharge information, but the biggest things are trying to keep their activity level to a minimum for about 1 to 2 weeks after surgery, and making sure that they're not trying to lick or chew at their incisions. Male cats generally recover really quickly because they just have 2 very small incisions. Female cats generally do well, but they do involve a little bit more as far as recovery. If they're cats that go outside, we're going to want to keep them inside so they're safe for at least the first 2 weeks, and then usually they'll have a cone that they'll have to wear when they're not being monitored to make sure they don't lick or chew at the incision. Okay, I hope this was helpful as far as understanding a little bit more about cat spays and neuters. If you have any further questions, please contact us at DePorre. Thank you.